Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A physical therapist examines a patient who complains of forearm pain and weakness in the hand. During the examination, the therapist identifies weakness with wrist flexion, finger flexion, and thumb adduction. Froment's sign is positive. Which of the following nerves is most likely affected? Option 1, ulnar. Option 2, radial. Option 3, median. Option 4, musculocutaneous. Peripheral nerve entrapment. Peripheral nerve entrapments in the arm occur when a nerve is compressed or irritated as it passes through narrow spaces, for example, muscles, connective tissue. Common sites include the carpal tunnel, cubital tunnel, and radial tunnel. Symptoms can include pain, tingling, numbness, or weakness in the area the nerve supplies. This particular question requires you to have specific knowledge related to nerve function and anatomy, as well as familiarity with Froment's sign. Let's review this special test. Froment's sign. A patient is asked to hold a piece of paper between the thumb and index finger as the therapist attempts to pull the paper away. A positive test is indicated by the patient flexing the distal phalanx of the thumb due to adductor pollicis muscle paralysis. Let's explore each of the options. Option 1, ulnar. The ulnar nerve is most commonly compressed in the cubital tunnel at the elbow. Since the ulnar nerve innervates the flexor carpi ulnaris, flexor digitorum profundus, and adductor pollicis, compression of the nerve can result in weakness with wrist flexion, finger flexion, and thumb adduction. In addition, ulnar nerve involvement would be associated with a positive Froment sign. Option 2, radial. The radial nerve innervates the wrist and finger extensors in the forearm, as well as the brachioradialis and supinator muscles. Compression of this nerve would more likely result in weakness with wrist and finger extension. A patient with radial nerve palsy would exhibit a wrist drop deformity. Radial nerve involvement would not be associated with a positive Froment sign. Option 3, median. The median nerve is most commonly compressed in the carpal tunnel at the wrist. Since the median nerve innervates many of the wrist and finger flexors, for example, flexor carpi radialis, flexor digitorum superficialis, and profundus, it too could result in weakness with wrist and finger flexion. The median nerve does not innervate the adductor pollicis, and therefore, Froment's sign would be negative. Option 4, musculocutaneous. The musculocutaneous nerve innervates the biceps brachii, brachialis, and coracobrachialis muscles. Compression of this nerve would more likely result in weakness with elbow flexion and forearm supination. Musculocutaneous nerve involvement would not be associated with a positive Froment sign. The correct answer is option 1. Let's explore the all-student data. 60% of students selected option 1, ulnar, the correct response. 10% of students selected option 2, radial. 25% of students selected option 3, median. 5% of students selected option 4, musculocutaneous. System classification. This question is a neuromuscular and nervous systems question, which represents approximately 24% of all exam items. Content outline classification. This question is a physical therapy examination question, which represents approximately 24% of all exam items. Level classification. This question is a level 2 question since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Academic focus area. Looking to review related academic content? Check out pages 109 and 271 in PT Exam the Complete Study Guide. Thanks for joining us on the Score Builder's question and answer video session. See you next week.